Right, so a big focus on the program today has been reflecting on government's vaccination rollout plan. It's come under fire for ways through which this has taken place, and part of the critique comes from the government's decision to sell off those 1 million AstraZeneca vaccine doses, and this is despite advice from the World Health Organization that these doses are still safe and useful. For more perspective, let's bring in Chief Medical Specialist from the University of KwaZulu-Natal, Professor Mosa Moshabela, who joins us now via our video link. Prof, thanks once again for your time. Always great getting your insights on these issues. Professor Madi, who has also spoken out against what government has done, describes the past few days as a series of mistakes, as we saw those 1 million AstraZeneca doses head off to other countries before we even started our inoculation plan. Do you agree that things went wrong the moment we didn't take the World Health Organization's advice on this?
Yeah, it's a difficult one, and greetings to you and the viewers. My own view, I mean, in part I agree with Professor Madi, but on another side of things is that there is also a lot of uncertainty around this. My problem is not so much the decisions themselves. I think that those decisions are made based on the fact that there are inputs from scientists. The main issue that I have is that amongst the scientists, there's no agreement. That's where my main issue is. You know, if there was consensus among scientists, I suspect that there was going to be one voice that is speaking to government. But at the moment, you know, you've got the likes of us, Professor Madi and others, now debating with the scientists who are in the MAC about these kind of decisions. My own view is that I wouldn't necessarily pass judgment to say it's a series of mistakes. We will know in hindsight the extent to which all of this are mistakes. But what we do know, that is really not ideal. We know that it is not a desirable situation that we are in, and it is compounded by the fact that there are delays in the vaccines that we are expecting. You see, if these new vaccines were here and were able to timely replace the stock that we have given away, we would be having a different conversation.
So who then?
So it is then when you balance these issues that you can say in hindsight that, you know what, that is not good, that is bad. But I do think that the main problem really stems from scientists not agreeing.
Right, and perhaps you've answered my next question in part. Who then should be taking the fall for where we find ourselves in a context where the very scientists who are meant to be advising government are not singing from the same hymn book?
Yeah, it is difficult. And I mean, at the end of the day, you know, you've got on the one hand, you've got a scientific debate. On the other hand, you've got a policy debate. And those two things are not necessarily the same. Now, oftentimes we find ourselves where there is a common voice from a scientific debate point of view. When that happens, then we get into a policy debate where government starts to bring other interests into the scientific consensus. And that's where you tend to see disagreement between scientists and government. But in this case, to be honest with you, I think the way I see it is that amongst us as scientists, we have not agreed about AstraZeneca. There are those who are willing to be more conservative and basically not take any risks. Then there are those who have a high risk appetite to say that, look, balancing the odds, it's better to go with something that is not perfect but still good enough, or at least has some promise, than not have anything at all. And usually when it comes to that point, then you start to enter into a more ethical debate rather than pure science, because here you're balancing the evidence. It's like having a puzzle, Ayanda, that is incomplete, and you're trying to build a picture with it. So anyone who says you're wrong, someone says you're right, they could be right. That's why I'm saying that, you know, in this case, I think that for me, it's the lack of scientific consensus that's really hamstrung the process going forward. We made a big deal of the fact that AstraZeneca it has low efficacy against the variants. We cannot necessarily blame government for having made the decision then on that basis. However, and informed by the MAC. However, what we are saying is that now that we know and new evidence is emerging, we should not have sold those vaccines. The main point here, Ayanda, would be whether South Africa would be willing to use AstraZeneca in the future. That's what we have not addressed. And for me, that's my concern, because on the one hand, this is water under the bridge. The vaccines are gone. But we do have to be able to distill this matter from a scientific point of view so that we can have a position about AstraZeneca. We have not resolved that. And I think government needs to encourage scientists to be able to resolve that matter so that it can give them the direction.
Incredibly sobering perspective, one which I'll admit I haven't heard in this entire debate. That, the complexities run deep because, in part, the very individuals, the scientists who are advising government about what to do next aren't necessarily in agreement. This will take some people by surprise because, by the very nature of science, the perception had always been that the empirical evidence as it stands often enough shouldn't leave room for debate. It appears when it comes to things like COVID-19, etc., that's not necessarily true.
No, it's not necessarily true because you have a large margin of uncertainty. As I said, I think to me, in navigate this whole pandemic in the past year feels like working with an incomplete puzzle and trying to make the best decision you can. And so I do think that I cannot speak to what advice got from scientists, what advice was given to government from scientists, because government is advised by the Ministerial Advisory Committee on Vaccines. And Professor Shub, who's the chair of that committee, came out and put out an article which basically supported the decision of government, which gives off the impression that that was the advice that was given to government. And so, but then also you have the likes of Professor Mahdi, who actually is quite open about the fact that he doesn't support what has happened with AstraZeneca. So if now you pit, if you see that Professor Mahdi and Professor Shub don't agree, then you then have to wonder exactly what advice should have been given to government. And that's what I'm talking about. And I understand that debate because I also, on the one hand, see the arguments that Professor Shub is making about the sort of concerns around AstraZeneca. And the concerns around AstraZeneca vaccine are not just in South Africa, they are global. There have been many, several of them. We can list a long list of those concerns that then kind of makes people who are risk averse, to basically use those challenges to say, let's take a more cautious approach when it comes to this vaccine. But then when you now have to look at the cautious approach, that then means that you give away something and you're left with nothing. It creates a problem. And this is where we are saying it's better to have one bird in your hand than chase two birds in the bush. That's where the other side of the argument is coming from. But as I said, I think for me, I think that this is unique. If I use the example of ivermectin, ivermectin was interesting because most scientists agreed around the fact that they don't support ivermectin use given the weak data. The people who were advocating were actually practitioners who are not necessarily scientists. And I find that debate interesting because now it was a debate between scientists and practitioners. But at the end of the day, the science itself was not able to support the use of ivermectin. A lot of it was coming from advocacy. And so there you are seeing disagreement, but it's not between the scientists. It's actually largely between scientists and practitioners.
Extraordinarily interesting. Yeah. And let's actually run with that. Just in case you're watching this and you don't remember ivermectin, that was the drug that was introduced and apparently had really good effects for preventing severe disease of COVID-19. But it took place in a context, as the Prof explains there, where there wasn't much scientific data to back it. But Prof, the empirical data, the data on the ground, so to speak, from practitioners had to hold water. It had to count for something. So in a context where we're not quite sure whether it's just science lagging behind or science not being able to, I guess, keep up, how should a government that needs to introduce policy respond to that? Because we saw government, again, butting heads and running into walls around that issue.
Exactly, and that's why I bring it up, because it's something that comes close to this discussion around AstraZeneca. This is where, for me, one needs to understand the complexity of making a policy decision and things that have to take into account. With COVID-19, the biggest problem we have had is that there is no time, Ayanda. Like, you don't have the liberty of time, the space to basically explore. You don't have that. In many other things, we have had sort of space to explore evidence and so forth. With COVID-19, we have to act fast. And that means we make decisions with the little that we have. And in that process, it's easy to make an undesirable decision. And in hindsight, we can go back and say that was not a desirable decision. However, this is where also we have seen scientists now work closely with government through the MACs, the general MAC and the MAC for vaccines, because government needed that support. But we've also seen, in this case, the public engage with science in an unprecedented manner. And what has happened is that what would normally be scientific debates among scientists easily spill over into the public, and they become public debate. And so people will then use anecdotal evidence that makes it difficult to then counter once the narrative gets gets really strong. At the moment, I think that the point is that we are not necessarily making policy decisions based on anecdotal evidence. We make policy decisions based on scientific evidence. And this is what the MAC for vaccines is arguing, is that with the data that we have in front of us at the moment, they are not able to support the AstraZeneca vaccine. However, there is emerging data elsewhere that seems to support this. And there is a plausible hypothetical reason why AstraZeneca should be supported. But once again, this is where I'm saying that I would not necessarily be quick to find someone to blame. We will know later. When we have got all the information at a later stage, I think that we will be able to see what would have been the best decisions, but we will know that in hindsight. Right now, for me, what I would not want is for the debate to basically derail the preparation for the third wave. That I would not want.
Absolutely.
Because
if I can come in there, Prof. So as we do that, I mean, and it's also important to also give perspective of what's happening further afield. We know that I think the European Medicines Agency has come out to say that the AstraZeneca vaccine is in fact safe and can be used, despite those fears around blood clots. Some of their counterparts in the United States have pretty much shared some of those sentiments. Keeping in mind the issues and concerns around the narrative that you've just explained, how important is it for individuals, even within the MAC, to come back to South Africans and say, yes, we had advised government to go ahead and sell these vaccines, new data has emerged, we made a mistake, and we're going to go ahead and use this dose in any case?
Okay, so now you're getting into the next issue. We spoke about uncertainty so far. Now you're getting into the next issue that has been big in this pandemic, and this is the issue of trust. At the moment, we are operating in an environment where we don't trust each other. We don't trust government. We don't trust scientists. We don't trust the health system. We don't trust drug companies and so forth. Like, there is so much mistrust, that it makes it difficult when people do not come clean and be transparent. Transparency becomes really important. So the decisions that the government has made, as advised by the MAC, may not in themselves be a problem. But I think what we were calling for was for them to come clean. And for me, when I saw them come clean, government came clean. The Professor Shoup put out an article as a chair of the MAC. And for me, I was just like, okay, fine. They've made the policy decision. It's fine. We have got concerns. We are not happy. We would have liked them to reconsider this, but let's move on. I don't think at any point there was ever a debate in South Africa about the safety of AstraZeneca vaccine. This issue that came globally, yes, it was a public debate, a discussion, but among scientists, there wasn't really a concern around safety. The only concern really was more about efficacy against the variant that is dominant here in South Africa. But this issue of communication, becomes crucial, because that's all we have under these circumstances. When we've got a lot of uncertainty, the more people lay their issues and their decisions on the table, it minimizes the mistrust and it helps kind of increase cooperation. And this is why personally I called out for government to really come out and say, what is the decision, what is the plan? Because then we're going to need the public to cooperate when it comes to the third wave. But we cannot do that when we are also not being transparent and being told about non-disclosure agreements. Those things make it difficult to basically garner support and cooperation of the public and scientists and healthcare workers when we do not know exactly what is happening.
Right.
And when that happens, the problem, just the final thing I want to say, when that happens, the problem is that it creates a lot of room for disinformation. That's the problem. Misinformation comes in, myths come in, a whole lot of other stories, and that then tends to divide us a lot.
Absolutely. And in the context of increased vaccine hesitancy, that's the last thing we obviously need. I had heard some experts mention that AstraZeneca actually doesn't have a science problem, so to speak, but has a PR problem.
Yes.
To what extent, very quickly, would you agree with that?
No, I agree. I actually also have been, saying that as well in various discussions with other people, to say that, there is a big PR problem for AstraZeneca, and it comes from the company. I mean, I think what we've been told is that AstraZeneca is the first time it's actually doing a vaccine development. And so even initially, Oxford was going to go with Merck, and Merck has experience with vaccine development. But the British government wanted a British company, and then they chose AstraZeneca. On the whole, they have done well, but they have made a series of mistakes from the beginning. I mean, we were listing the number of kind of public scandals and outrage that came because of AstraZeneca, but they've got a serious PR problem, and it's affecting all of us. I do think that even here in South Africa, we do have a little bit of an issue communicating to the public some of this medical jargon, and but I hope, on the whole, I do appreciate that information does eventually come out.
Absolutely.
Like this past week, we've seen a lot of information come out.
Prof, you and I can go on until the sun sets. I'm told we're woefully out of time. Thanks very much for your insights. Always appreciated for your making time to chat to us. Professor Mosa Moshabela is Chief Medical Specialist at the University of KwaZulu-Natal.